So just sort of looking at some recent data of drugs that have some activity in metastatic triple-negative breast cancer, there were two drugs that I wanted to sort of keep an eye on. One was a drug called sacituzumab TMT, and basically the antibody part of it is TROP2, and the drug part of it is vedotin-ejfv, which is a novel topo-1 inhibitor. And this trial was looked at in a randomized phase 3 study in which patients were pretty heavily pretreated, had at least 2 regimens in the metastatic setting, were randomized to SAC TMT versus treatment of physician's choice. And basically what they saw was that the event progression-free survival was almost double. It was 6.7 months versus 3.5 months. So that's something to keep an eye on. And also they noticed that noted that overall survival was also increased in the SAC TMT group. So I would sort of keep my eye on this drug and see sort of where it pans out. There's a lot of competition in that space. The second ADC that I thought was pretty interesting was something called enfortumab vedotin or EV202. Basically, the antibody part of this targets something called Nectin-4, which is an adhesion molecule which is highly expressed in solid tumors. And the payload is one we've seen before called MMAE or monomethyl auristatin. It's an antimicrotubule agent. And in this trial, pretty interesting, this trial also was in a heavily pretreated group of patients who'd had at least one regimen in the metastatic setting. All patients got the investigational drug. And when we looked at the overall response rate, it was 19%, which you might say, oh, you know, we can do better than that. But the disease control rate was 57%. So I think it's worth looking at. And when they looked at overall survival, with a median follow-up of 12 months, it was what we've seen in some of the other trials, and that it was just a tad under 13 months. So I think that this is something, this drug needs a lot more work, but I feel like it's pretty interesting, so we should keep an eye on it.